get there. So I don't need 8. But for some of you, you may need 8. So what are you going to ask?
So when you sleep, your heart rate also goes down.
Absolutely.
Right.
You get right down. That's probably some of the times when your heart rate is going to be the lowest in your day.
Right.
Right.
So is that?
But it will spike up when you dream and all that too. So it will actually go up when you're actually having some of these vivid dreams, and then it will drop right back down again. So if you have one of these monitors, you can sometimes just look at that and go, oh, what happened there? No, you weren't having sex. You were having a dream.
So is there a limit? Like, it should. Is it the lower the better, or is there a limit? Like,
No. There isn't. There isn't a
Zero
number
is
that
not
you
good.
need to. There isn't a number you need to hit.
Okay.
That's all I dream. That's anyway I dream. Michelle.
There isn't a magic number of what your resting heart rate needs to be, right?
Uh-huh.
It's just if your resting heart rate is persistently at the higher end all the time, that says that you just don't have the right cardiovascular fitness. Right? And a good test of that is always, how quickly do you recover when you come up with symptoms, right? Because if you're really very unfit, it takes you a lot longer. I just said, I can't remember, it was Harish or whoever I said, that the moment you put your foot on the green, you just get all of that tiredness vanishes. It's because we've been doing it over and over. If it doesn't, okay, guess what? You are going to have to go to the gym. Because your fitness is not there.
Shailesh, sometimes I'm sitting and the watch says your heart rate is above 100.
Right.
Just sitting.
Yeah.
And
Because
that goes away.
it goes away because something obviously stimulated it.
Yeah.
Whether it was coffee, alcohol, or some excitement or whatever. Now, if
Or
you are one of those
daydreaming.
where nothing had happened and it is just spiked up for no good reason, then I think that you probably will need to have someone sort of look it
I
over.
did. I went to they did the nuclear test and
Right,
everything, and they said,
right.
you're good, man. What's
Right.
the problem?
So then maybe you do have issues with cardiovascular fitness, and maybe you do need to get fit.
That's
Correct.
what they said, nuclear test.
They did the nuclear
No.
test.
Cardiovascular fitness.
Yeah.
So you need to get exercise, you need to actually improve your heart rate not monitoring, but your
Basically,
fitness.
you cannot just escape at the very last minute on anything. Including golf.
Change the plan, it's not good.
Just because of some pretext, rain RI, cloud RI.
Venkat, that's because you need better sleep.
Anyway,
Stop going morning and
all right, so then,
Sorry,
yep.
that's good one, right? Because my Apple Watch Fitness leads me telling me about exactly what you said about heart rate, cardiac recovery. And he said in the last 5 months, my recovery time is about 22 seconds.
Yeah.
Then he said 9 months ago, it was 30 seconds. So going from peak heart
Yeah.
rate to, right?
Right.
So Apple Watch has, your watch should.
And you shouldn't rely on technology, you should rely on common sense. I mean, common sense tells you where you need. And the numbers help, and I think monitoring helps. But you also need to say, how am I going to change these things, right? So, that is where you're at. And yeah, I hate to say it, but you can't do too much about visceral obesity. So even though I don't look like I'm an obese guy, I may have bad visceral obesity compared to someone who has a big paunch. So it's the inside fat that's actually more toxic than the outside fat. Right? So you do need to actually say, okay, how can I change that? And it starts with everything. Diet, weight loss, paying attention to the risk factors. And then obviously, I think all of you should get your lipid levels checked because that's something you need to look at. And that LDL cholesterol, which is if your triglycerides are okay, should be really close to 100 or even double digits, okay? Less than 130 is acceptable without any other risk factors, but as you get older, you need to sort of say, do I do better? And actually, saturated fat, not eating cholesterol, is the one that puts your LDL
59.
cholesterol. So it's the saturated fat in your diet. Right? And saturated fat comes from everything. Remember, just by being vegetarian doesn't mean you're eating
Oh,
healthy.
you're more relaxed.
There is some vegetarian shit out there that, trust me, is worse than being a non-vegetarian. Okay, so you need to look at your diet and make sure that you're eating the right way. Okay. And yeah, you need to control that blood pressure. What is a blood pressure number? Everybody's individual. You need to know what you start with. Ideally, the lower the better without actually falling over. If you make your blood pressure too low, you're going to fall over every time you stand up. That means you overdid. But if on the other hand, the lower you make it without keeling over, the better it is for you. Long
What's a
term.
normal average?
There is no normal, but if you had to say, where do I start or what's a marker that I can start at? I think if you're better than 135 over 85, or close to that number, that's a good number. Can you be higher or a little lower? Sure.
Because yesterday somebody was telling me that the Heart Association has changed those numbers to less than 120 to less than 80.
That is only for those people that have comorbidities and issues, right? So if you have diabetes, for example, you have risk for other stuff, that seems to be like a good thing to do, because it turns out that for interventional studies, that makes sense.
Okay.
But for the average normal person, I mean, trying to force it that way is going to be tough. But if you do it with the natural stuff, again, remember, exercise reduces 1 day of exercise. The next day, if I put a cannula in your brachial artery and did continuous blood pressure measurement, right, and then I did it without you exercising, and then looked at the next day, exercise gives you lower levels of average blood pressure control the next day. See? Exercise gives you, and that's been done. See, I was a medical student when my buddy who was doing research doing that actually showed that, right, back in the 80s, 1980s, yeah. We actually had people cannulate their brachial arteries and walk around with this continuous sensor. Exercise, blood pressure gets down. So you need to do all those things. And then diabetes is a long course, but if you have glucose intolerance, okay, guys, it's carbohydrates. You just have to read it, and that's it. There's no choice. And then that brings all the other things that you have to then follow. Eyes, make sure that your stuff is good. But in terms of cardiovascular fitness, that's what you need. Now, let's say you do have heart disease. Okay, one, blood pressure control now becomes more paramount, cholesterol becomes more paramount, and exercise becomes more paramount.
Shailesh, any advice on the fatty liver? I think most of the Asians have fatty liver.
Yeah, fatty liver is something that, again, is part of the metabolism. So that is metabolic, right? Can you do anything about that? Right now, there are very few good things that you can do. Weight loss certainly can help, right? But controlling your blood glucose actually is a big impact, much more impactful. Some medications are being investigated right now to see whether it can do that. The fatty liver per se is not the problem. It's when the fatty liver progresses to something is the problem. Okay? So you can't do anything directly about it, but you can do something about the downstream consequences. And yeah, I think that in that case, it elevates your risk factor one more notch to say you now need to focus more on controlling some of these things as opposed to neglecting it. All right?
Touch on salt also.
Yeah, salt is very, very difficult because people have come out with all kinds of things about salt is bad for you, salt is good for you, salt doesn't do anything, salt is neutral. I think overall, the thing about salt is, if you're not a unique person in the sense that you're like an average person who can kind of handle the salt, probably you don't want to try and eat too much salt. Turns out in heart failure, interestingly, restricting salt has not been shown to be helpful. But for people with blood pressure, it has been. So it depends upon who you are in context. Because remember that blood pressure is driven by more salt and water retention, which is what your heart's pumping to then give you the hypertension. The lower the salt intake, the lower the fluid retention, and the better your heart is actually able to pump. Right? So it depends upon the context. If you happen to be someone who actually just happens to have a low blood pressure, then restricting your salt may not be a good idea actually. Because that's all you're working on. You know, if your blood pressure runs 90 over, 60, which is you normally, right? Nothing wrong with that. But that person doesn't have a lot of leeway if they get dehydrated, right? So there's no tank left, then they're going to kill it.
What is the ideal blood pressure today?
Well, 135 over 85 for people without any issues is a good number. And I think that if you have diabetes and you have heart disease and you have other stuff, then the lower the better. So for people with diabetes, that number is now slowly coming down to about 120 over something, 120 over 80. But 135 over 85, so the standard used to be 145 over 90 was the standard.
So 135 over 85 is fine.
Yeah.
But somebody was also.
But remember that blood pressure changes completely, it's contextual. So this is resting blood pressure when you're actually resting, right? Don't measure it when you've been walking around.
Thank you so much.
Yeah.
Well, thank you, man. It's awesome.